Glucose control is certainly an important part of management of diabetes, and we know that, and we've known that for a long time, and it can prevent certainly microvascular complications, kidney, nerve, eye damage. But when it comes to preventing cardiovascular disease, it probably only has a small role in comparison to the role of blood pressure and cholesterol control. And that's been sort of the state of knowledge for a while, and then in the last year and a half, 2 years, there's been a real explosion of knowledge, and that really relates to diabetes drugs that are used to control blood glucose, but turns out they have an added benefit to reduce cardiovascular disease. We only had one drug for many years that fell into that category. In other words, a drug used to treat diabetes that lowered cardiovascular mortality, and that was metformin. In the last year and a half, 2 years, we now have two more drugs, two more classes of drugs. One is the GLP-1, glucagon-like peptide 1 agonist, that was shown in the LEADER trial to decrease cardiovascular mortality. That was a big discovery. And then the SGLT2 inhibitors similarly shown to decrease cardiovascular mortality as well. Both of those drugs in the studies that demonstrated their reduction in cardiovascular mortality were in people with significant risk for cardiovascular disease. So we know that those drugs lower cardiovascular risk in those that are at very high risk. What we don't know yet is whether those drugs could also be beneficial in terms of cardiovascular risk in people with even lower risks at baseline of cardiovascular disease, and that's going to be the next step in the research progression. But overall, we've made a lot of progress here, and we have now some new tools that treat not only blood glucose, but also lower cardiovascular mortality.
As a cardiologist, I don't primarily treat patients with anti-diabetic medications, but many of my patients are on anti-diabetic medications. We know that the more of these medications they're on, the worse their metabolic risk, the worse their diabetes. I'd like to have them on fewer medications if I can. Certainly, those patients who are on insulin are at increased risk as well. We know that patients with lower blood sugars will have a lower risk overall. What we don't know is whether if we lower those blood sugars, can we reduce their cardiovascular risk? There's a hint in that. With metformin. There's a hint in that with GLP-1 agonists. And we think we can probably reduce cardiovascular risk with an SGLT2 inhibitor. The SGLT2 inhibitors are actually quite interesting because these are drugs that essentially cause us to urinate out glucose. So it lowers the threshold at which glucose is excreted by the kidneys. It lowers hemoglobin A1C and lowers glucose in the blood and hence hemoglobin A1C in that way. But the benefit that was seen in the EMPA-REG trial may not be due to that effect. It may be due to the fact that you're actually getting rid of both glucose and sodium. And so to some extent, they may be functioning as diuretics. But one of the most important findings in the EMPA-REG trial, which was a study of empagliflozin in patients with diabetes, was a reduction in heart failure. And it suggests that these drugs may actually have a benefit beyond glucose lowering.